like so many things that seem to have been in a holding pattern over the last several months, we haven't had the opportunity to get an update from the Addison Early Childhood Collaborative in a while. Today I'm here with Mary Haley from the Collaborative, as well as one of the Collaborative's partners, DuPage Health Coalition. We're here with Charito Bularzik, the education coordinator for DuPage Health Coalition. We're going to talk a little bit about what's been going on with the Collaborative in the last few months, as well as some programs and benefits that are available to residents. Mary, like a lot of agencies, I think the Collaborative has kind of had to pivot into new and uncharted territories over the last few months. So kind of give us a synopsis of what you've been up to. I don't think it's what we've usually heard from you about this time of year.
No, things have been a little bit different, Dory. We have been real focused on providing direct services to families. So we have reached out to get additional funding from some partners so that we could do months of diaper distribution for families, and in addition to that, help some families that are really struggling with food insecurity. Some of the funding that we got from partners also enabled us to support the Addison Township Food Pantry.
Oh, that's
so
great.
We really did pivot, and instead of focusing on everything that we had planned for the year, like everybody else, we changed and focused on what do families in Addison need right now to help them deal with the situation. And that's what we've been up to for about the past 3 or 4 months.
Any idea how many families you were able to help over the last several months, or is that kind of, all over the place? I know tracking is like the least thing on the priority list.
You're right, but we do have a little bit of a sense of that. The diaper distribution that we did for several months, we supported just about 200 families.
Wow.
And then through some of the work that we did to get food to families, we worked with about 100 families or so. And then I had some information from the township about the number of families that they had coming through, and it had about tripled at the point in time when I talked to them. So don't really have a count for that, but we just know that their caseload had gone up dramatically, so we were able to help a little bit with that as well.
Now, as the school year kind of gets started for people, tell me about what some of the things that you're dealing with. It's a strange time for parents and for students and everyone. So what are some of the things happening this fall?
It is a strange time, and I think everybody knows that it's going to be a learning curve, no pun intended, just trying to figure out how to work through this. But we're focused on working with the Addison Early Learning Center, with the Addison Children's Center, with the library, and other partners to make sure that families are getting whatever kind of support they need to help their kids with the remote learning.
Everything is virtual this fall, correct?
Everything is virtual this fall for the time being. Yep.
Mm-hmm. And I know that the Park District is also kind of helping out for those, especially those families who don't have the luxury of working from home. They're dealing with day camps for their kids.
Exactly. The Park District has launched the Remote Learning Day Camp, and they're going to be providing services for families 5 days a week. And families can get on the Addison Park District website to see all of the details about that. But it's primarily geared for a little bit older kids. It's not for the group of kids or the ages that we typically work with, but for elementary and middle school and older kids to have a place to go and get some support and also do something fun while they're there. So that's their Remote Learning Day Camp.
Right. Well, Mary, introduce your partner here today. We haven't had a chance in the past to talk with DuPage Health Coalition. Tell me about your partnership with them in the Collaborative.
DuPage Health Coalition is a really valuable partner. It's a nonprofit organization that provides affordable health coverage and health care to families and people who are uninsured. So part of what we do for families is make sure that they're getting access to resources they need, specifically medical resources, because that's so important. And we know that all of the hospitals in DuPage County, along with hundreds of healthcare providers, are part of the DuPage Health Coalition. It's a great group, and they provide wonderful services to families.
Charito, welcome. Thank you so much for being with us today. One of the big things that we have heard about over several years, especially in working with the DuPage Health Department, is people's having the opportunity to sign up for Access DuPage. So let's start with that. What is Access DuPage?
Access DuPage is one of the programs that the DuPage Coalition operates. It is a program that helps people who are unable to buy insurance in the marketplace, private insurance or Medicaid. We are there to help those people. In order for people to enroll in our program, they have to be 19 years old or older. Mm-hmm. They have to live in DuPage County and for the last 60 days and meet our income guidelines. Access DuPage is working in the DuPage County community for the last almost 20 years. Mm-hmm. We started in 2002 connecting people to doctor's offices or clinics so they can have primary care. Mm-hmm. We also coordinate specialists for our clients, but they have to get a referral from their primary care physician in order for them to see a specialist.
So does this take the place of insurance? This is insurance for people who don't qualify for private insurance?
We are not insurance. We work like insurance, but we are not insurance. We are a charity-based program.
Okay.
And it's funded by the hospitals that are in DuPage County and private donations.
And what are the benefits that they receive? Are they just medical?
They are medical. They can access to a medical home, so they can go to see a doctor when they are sick or when they are healthy to take care of their health. We also have a program that is called a Dispensary of Hope. That is a free medication program. In order for our clients to get free medications, they have to have a prescription from the primary care, and then they can access to free medications. The Dispensary of Hope also is available for people who don't have insurance. So anybody who lives in DuPage, don't have insurance, they can qualify for this program.
And is that available at local pharmacies or a particular
they have,
site?
The Dispensary of Hope pharmacy, the one that we are working with, is located in Wheaton,
okay.
Across the street from the DuPage County offices. They have the Dispensary of Hope pharmacy there.
Okay. And the final program that the coalition is begun is Silver Access. Now, what is the difference between Silver Access DuPage and Access DuPage?
Well, Silver Access is a program. It's not insurance. It is an additional program that we have, the funds to help people who can buy insurance in the marketplace. That is available for citizens and residents. And those people have to buy insurance in the marketplace. And if they meet our income guidelines, they can get help from Silver Access up to $150 per month per member.
Uh-huh. Now, do people go onto your website to apply, or do they make an appointment and have someone lead them through this? How does someone get qualified or available for these programs?
Well, they have to apply for health insurance in the marketplace. They can do at the county office, or they can go online and apply themselves, but then they can call our office to get additional help with Silver Access.
I see. Now, as we were talking with Mary, everybody seems to kind of be pivoting in the last few months. I know COVID-19 testing is something that a lot of people are very worried about. Tell us about some of the testing locations that you have available for people.
In DuPage County, we have a testing place at the DuPage County Fairgrounds. That is open from Monday through Friday. They don't have to make an appointment. Starting on Monday, they will open from Monday through Friday. They, like I said, they don't have to schedule an appointment. They can just go. Sometimes there's a wait, but sometimes they can go in and out faster. For the people who live in this area, we have the Hunter Center. They have testing there on Tuesdays and Thursdays. Also, the VNA clinics, the one that is located in Carroll Stream, they offer testing from Monday through Friday. And the VNA in Bensonville offers testing Tuesdays and Thursdays. They always have to call and see if they can get an appointment, but I don't think it is very hard to get an appointment, and all the testing is free.
And that's something to emphasize. I was just going to ask that because I know that the one at the county center is free. They're limited to the number of tests that they have available per day. But all of these other locations that you mentioned is also free.
They are all free, and some people are a little afraid because sometimes they are asked for an ID card. But the reason for that is because when you are using a mask, sometimes you don't understand if both sides are wearing a mask, sometimes it's hard to understand the name and the address. So the reason why they are asking for the ID cards, it is to make sure that they have the correct name and the correct address in order for them to send the results.
Right. And lastly, you have a project going on suitable for the pandemic. Tell us about the Coalition's mask project that's happening right now.
Well, we started the mask project in July, and we wanted to know if people needed masks that are used in our program, and we got an overwhelming response. We got like almost 9,000 requests for masks. For adult masks, and another almost 3,000 for children's masks. So we are currently accepting donations for masks, and we have received a lot of donations, and we are starting to distribute also for the families that need it.
And that information is available on your website as well?
We send a survey to our clients, and from then the word got out, and they started to call our office or send us an email to get requests.
Well, thank you both for being with us today. We've been talking with Mary Haley from the Addison Early Childhood Collaborative and Charito from DuPage Health Coalition. All of the information that she shared is available on accessdupage.org. We'll bring some more information up on the screen, and always remember that the Addison Early Childhood Collaborative is a wealth of information and resources here in our community. I'm Dory Pragi for Addiscene. Thank you for being with us.
Muy buenas tardes, un saludo muy especial a la comunidad de Addison. Estoy aquí para hablarles sobre los programas que la DuPage Health Coalition les puede ofrecer. El primer programa es Access DuPage. Access DuPage ayuda a las personas que no son elegibles para comprar seguro de salud en el mercado de seguros, en seguros privados o en el Medicaid. Este programa está disponible para las personas que tienen de 19 años adelante. Las personas que aplican deben vivir en el condado de DuPage por los últimos 60 días. Este programa no se fija en su estatus migratorio, entonces no tienen que tener temor. Nosotros somos un programa que no recibe fondos del gobierno, por lo tanto nosotros no compartimos su información con ninguna otra agencia del gobierno. También tenemos el programa Dispensary of Hope. Es un programa de medicamentos gratis. Pueden conseguirlo con una receta válida de su doctor. Este programa es en colaboración con el condado de DuPage y la DuPage Health Coalition. Todas las personas que no tienen seguro de salud, que no tienen Medicaid, pueden obtener medicamentos gratis con la receta válida de su doctor. También tenemos otro programa que se llama Silver Access. Ese programa es para ciudadanos y residentes. Este programa les puede ayudar pagando a su seguro de salud hasta $150 al mes. Para obtener la ayuda de Silver Access, una persona debe ser capaz de comprar seguro de salud en el mercado de seguros de Obamacare y ser ciudadano o residente legal. También últimamente hemos estado trabajando con un proyecto de tapabocas. Eso es algo que nuestros gerentes en Access DuPage pensaron que quizás nuestros clientes necesitarían máscaras o tapabocas. Entonces, en ese caso, les mandamos unas encuestas para saber si había la necesidad de tapabocas y la respuesta fue muy grande. Entonces, en el momento tenemos un pedido de casi 9,000 máscaras o tapabocas para personas adultas y tenemos como 3,000 más o menos pedidos para máscaras para niños. Es muy importante que todos sepan que también hay lugares donde se pueden hacer las pruebas del COVID-19. El lugar más grande que está haciendo las pruebas de COVID-19 es el Departamento de Salud de DuPage. Ellos están abiertos de martes a sábado, pero comenzando el lunes 31 de agosto, ellos van a tener las pruebas desde los lunes hasta los viernes. Para hacerse una prueba no le van a pedir su estatus migratorio, no le van a pedir que usted pague, eso es gratis para todas las personas que necesitan hacerse la prueba del COVID-19. Si le piden una tarjeta de identificación, eso tiene motivos bien específicos, que es para que ellos sepan su nombre y su dirección para que le puedan mandar los resultados. En esta área de Addison también está el lugar que se llama Hamdar Center. Ellos también están ofreciendo pruebas gratis del COVID-19. Ellos hacen las pruebas martes y jueves. La clínica de VNA también hace pruebas. La de Carol Stream, el VNA de Carol Stream, está haciendo pruebas de COVID-19 de lunes a viernes. Y el VNA de Bensenville está haciendo pruebas martes y jueves. Entonces, todas las personas que necesiten hacerse una prueba no deben tener miedo. Pueden simplemente llamar, hacer una cita y ir a hacerse la prueba del COVID-19. Bueno, esa es toda la información que yo quería compartirles hoy. Muchas gracias y tengan ustedes muy buenas tardes.